it's not all in your head, says neurologist Suzanne O'Sullivan on psychosomatic illness. In her clinic, neurologist Suzanne O'Sullivan often sees patients with psychosomatic illness, conditions she believes are widely misunderstood. She's now on a mission to change that. UK neurologist student Dr. Suzanne O'Sullivan spent her life treating psychosomatic illnesses or disorders in which people suffer from debilitating physical symptoms that cannot be explained by a physical examination or medical investigation. Now, I'm going to tell you what happened to me. I was so sick at one point I couldn't even sleep. And the doctors didn't know what was wrong with me. And I said to myself, you know, I can't, if I can't even sleep, I can't work, I can't take care of my family, nothing. And I had a dream, and I went to confession. That was my first confession. I was so sick, I didn't know what was wrong with me. I was in pain everywhere. And after my confession, what happens was you kneel down and the priest puts a stole over your head and does the excommunication prayer. And that's when I became better. I was healed immediately. With the eyes of my soul, I saw someone white standing next to the priest, pulling something out of my body, and all my cells in my body changed from my toes to the tip of my hair. And I became healed that instant. And I called my doctor the next day and I said, you know, I'm well. He said, what happened to you? I said, I went for confession. Oh, he says, oh, it was psychosomatic. I said, no, it wasn't psychosomatic. It was my sins making me sick. So, you know, we do have Jesus Christ present in Holy Communion, Holy Confession. Now, back to this, though. Psychosomatic illnesses may overlap with what are termed functional disorders, though the latter may not have any psychological component. One example of psychosomatic illness are psychogenic non-epileptic seizures, in which a person experiences seizure-like attacks without the telltale explosion of electrical activity seen in the brains of people with epileptic seizures. Medicine has a long and anonymous history with conditions for which they cannot find a physical cause, often dismissing them with sexist terms such as hysteria. But that is a fundamental misunderstanding of how these very real illnesses manifest, she says. While many people with these conditions are told it's all in your head or dismissed as hypochondriacs, that's problematic, says O'Sullivan, a consultant neurologist at the National Hospital for Neurology and Neurosurgery and the author of The Sleeping Beauties and Other Stories of Mystery Illnesses. As part of her work, O'Sullivan aims to reduce the stigma and clear up misunderstandings about psychosomatic illness. Life Science talked to O'Sullivan about why these conditions are so poorly understood, how they're diagnosed, and why treatments for them often fail. Emily Cook asks, how often are psychosomatic disorders misdiagnosed, and how many doctors are aware of the symptoms and how to treat them? Sullivan says, I don't think that there is a problem with awareness among doctors. I think there's a problem with how they explain it to the patients and their understanding of it, and whether they're open-minded to it being an unconscious process. So it's super common. When I was training, I was never taught. It was never taught, which is why we do it so badly. And I think that basically the problem is not so much that doctors are not aware. It's a problem that they still have lingering doubts that the person is really sick and not doing it on purpose. A lot of doctors still have lingering doubts that if you've got a pain due to a disease and a pain due to psychosomatic problems, the doctors still have a bit of a problem understanding that both these pains can be equally painful. So I think it's not an awareness problem, she says. It's a problem with a lot of old-fashioned hang-ups. They think it's not as severe as other diseases. They don't take it as seriously as other diseases. I think there's more of a problem rather than a lack of awareness, so they alienate patients into backing away from the diagnosis. I think a lot of people think that we make this diagnosis because we can't find a disease. We've exhausted all the options, and therefore we're saying, "Oh, we can't find anything else, it must be stress." That isn't it, she said. Usually we make it on positive features of the diagnosis for symptoms characteristic of the diagnosis. So in neurology, for example, the pattern of muscle weakness for someone with a psychosomatic disorder is a completely different pattern than for someone with a brain disease. It's so important that people understand we are not making this as a diagnosis of dismissal. We're not saying you have it because you look like an anxious young woman or because your tests are normal. We're saying it because features of the illness are consistent with it in just the same way as if you came to me with a migraine and you described all the symptoms of migraine. I'd say it's migraine based on the symptoms. EC. Is hypochondria a form of psychosomatic disorder? SO. What happens in hypochondria is that people are disabled to worry about disease and they might not actually have any symptom. But it's anxiety about developing a cancer or some tiny little lump. It's the anxiety that disables them, whereas in psychosomatic symptoms, often people have no diagnosed anxiety or depression or emotional symptoms, and it's purely the physical symptoms that disable them. EC. Are some people more prone to developing psychosomatic conditions or maybe experiencing them multiple times in their lives? SO. I think there are people who have a tendency to it, so I see people at quite a severe end of the spectrum with psychogenic seizures, and most of the people I see will have multiple other symptoms. So before me, they will have seen the cardiologist with palpitations, and they will have seen the rheumatologist with joint pains. So it's a kind of thing that you have a tendency to, and therefore you might get it lots of times in lots of different forms. We're all a bit different. Some people complain by ringing their mother and complaining for hours, or some people cry, some people take to their beds. And this is just a way that some people express their distress. And if you do express it that way, you will probably express it that way in multiple forms, and you probably will always will. So even if I'm able to deliver the diagnosis perfectly to that person so that they understand it and are able to work with it and get better, in the future they will get another psychosomatic symptom, but the difference will be that the next time they will feel it, that sort of attention cycle, that fear and avoidance cycle, they can stop it so they get the symptom and it does not lead to disability. EC. But then they're learning these techniques, and so it's about how you respond to that symptom when it happens that decides what will happen next. If you can just adjust how you respond, you might find that the next symptom you get is really brief and transient, and you get better with time. EC. You mentioned in your talk that you see a lot of these seizures in a week that have a psychological cause. Are they the most common symptoms that you would see of psychosomatic disorders? SO. Well, no, they're the most common I see because I am a neurologist who deals with epilepsy, but basically these things are quite equally common in every symptom you can imagine. So I don't want to claim to know the statistics for cardiology, but I would imagine it's very similar, that a very similar percentage of people who go to a cardiologist with chest pain and palpitations, I see it as a psychological seizure. My colleagues who deal with nerve diseases see it as paralysis. The cardiologists see it as palpitations. I can't explain to you the percentage of every group, but I think that it will probably represent a third of consultations for most specialists. EC. So looking forward, you mentioned that this is a relatively newly defined area of science. You talked about it in the 21st century. What are the big emerging topics or unanswered questions that are facing the field right now? SO. I'd say in the last 20 years, scientists have really become interested in psychosomatic illness, and the main focus of attention at the moment is really trying to understand these brain mechanisms. And I think it's an enormously useful bit of research because the difficulty with patients, and you can imagine if you were paralyzed or someone says this is psychosomatic, and the thing that will mostly help you move forward is if the doctor can say to you, these are the brain mechanisms that are causing your paralysis. A real stumbling block for people is like, how could stress possibly cause this? I guess from panic attacks too. So the big focus for research now is mechanisms to help people understand what's happening to their bodies. But I would say that we are at really still making almost no progress and is actually on treatment. We're still kind of using short courses of talking therapies and things that are not terribly successful for these things. EC. So at the moment, it's mainly focused on treating the psychological side. So like psychotherapy, you mentioned CBT, cognitive behavioral therapy, for example. So yes, it depends on the symptoms. For psychosomatic seizures, the standard treatment is CBT, the cognitive behavior therapy, and that absolutely works for some people, and then it does not work for others. It's only really in recent years that they really began to remember these things are physical diseases, so that somebody who has this, they're physically disabled by their seizures, physically disabled by their paralysis. And this is by Emily Cook on Live Science. Please leave your comments and thank you for your support. Support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.